Welcome to Chapter 21, the immune system. And in Part 4, we're going to talk about one group of chemicals of the innate immune system. And these are going to be chemicals that initiate the inflammatory process. Now remember, a lot of times in lay speak, we talk about inflammation like it's a bad thing. But inflammation is a protective response when an infection occurs. And an infection occurs when a bacteria or pathogen breaches your surface barriers and releases some toxins or tries to hurt you. So then your body is going to respond to the infection with the inflammation process. All right. So we've talked about some of the cells. Now we're moving into the chemicals. The first group of chemicals we'll talk about are the inflammatory chemicals. So inflammation is a non-specific response. It is part of the innate immune system. It's going to be a response to any kind of tissue damage that can happen from heat or chemicals, infection from bacteria or virus or fungus or protozoan, or a physical trauma. Inflammation is beneficial because it tries to keep the infection local and prevent it from getting into the bloodstream where the infective material could move throughout the body. It's also going to dispose of the cellular debris. So this is like damaged tissue and things like that, as well as the pathogen that caused it. It can alert the adaptive branch and set the stage for repair. So let's look at some cells that release inflammatory chemicals. And these are going to be your mast cells, your basophils, and your macrophages. So we have met basophils before. These are a white blood cell. A mast cell is very similar to a basophil, where the basophil stays in the blood and the mast cell moves into the tissues, specifically the connective tissues. This is a macrophage. I hope you recognize it by now with its long arms that go out and grab stuff and help it phagocytize. So let's look at basophils. It's a white blood cell. And when we talked about it last, we talked about its role in allergy and response. And these little granules in it, these little tiny purple dots in here, contain two chemicals, histamine and heparin. Histamine is a vasodilator. It increases blood flow to that area. And so the basophils will release histamine in infected areas. And think about this. So we're going to vasodilate. So look at this vessel right here. This is a normal size vessel. This is a dilated vessel. You're going to increase the amount of flow of blood coming to an infected area. That is going to provide more blood that has more protective chemicals, platelets, things that we will need. So we're going to increase. It's kind of like when you're dirty and you get in the shower. You don't want the shower to just kind of drip on you. You want a lot of pressure with more water to clean you off. So we're going to bring more blood to help fight the infection. Histamine also increases capillary permeability, which means it's easier for cells to diapedesis. Remember, that's when cells move out of the blood into the tissue. And so when the capillaries are more permeable, that can happen more easily. Now in allergies, you notice this response because everything is kind of drippy. Eyes are drippy, nose are drippy, you might be kind of puffy. But histamine is, and so you take antihistamines to react against that. Histamine is very beneficial in jump-starting the inflammatory process by bringing more blood and chemicals to the area. Basophils also release heparin. Heparin is an anticoagulant, which means that it prevents blood from clotting too quickly. So we have opened up the capillary permeability. What we don't want to do is clot it off and prevent the blood from flowing. So basophils are very important for inflammation. Just like basophils, mast cells also secrete histamine and heparin to increase blood flow and decrease clotting, but mast cells are found in connective tissue, not in the blood. Macrophages are the phagocytes. We've talked about macrophages being a phagocyte. We've talked about macrophages being an antigen presenting cell. So it can gobble up the bacteria or germs. It can present that to the innate system, to the adaptive system to activate it and get it going. It also can release two different kinds of chemicals, prostaglandins and pyrogens. Prostaglandins are hormone-like chemicals that increase or enhance the inflammatory response. So they're also going to cause vasodilation. They're also going to increase capillary permeability. They are also going to help neutrophil chemotaxis. Remember, chemotaxis is the process of a neutrophil kind of sniffing out where the damaged tissue is, so it knows where to get out of the blood and go into that tissue. So chemotaxis is, chemo means chemical, taxis means moving, is the process of following the chemical trail to the damaged cells. Neutrophils will experience diapedesis as they leave the blood and they're on the chemical trail. So diapedesis and chemotaxis are two big fancy words that go together that describe how neutrophils move and find infected cells to attack. Prostaglandins can also induce pain. And when we take NSAIDs, which are the non-steroidal anti-inflammatory drugs like ibuprofen and that's Motrin, and naproxen, which is like Aleve, they block the effects of prostaglandin. So they're going to block the vasodilation, they're going to block the pain. Pyrogens are a different kind of inflammatory chemical. They are going to go to the hypothalamus and tell the hypothalamus to raise body temperature and create a fever. The idea is that fever is also protective. A lot of times we think about inflammation and fever being bad things that happen, but they're actually signs that your immune system is working, and we kind of want to let them do their job. So as long as you're able to eat and drink and you have a fever, you might feel bad, that's okay. We really only want to medicate a fever when you can't eat or drink, or you're so listless you can't do anything. Now, you might not be able to do all your daily activities, but you're supposed to be resting when you have a fever. Okay, so macrophages make prostaglandins, which enhance inflammation. They also make pyrogens, which induce fever. All right, let's look at inflammation. So again, remember, infection refers to what happens when a pathogen enters our body and then starts multiplying. Inflammation is the body's response to infection, and it is protective. It is a sign that your immune system is working and that it is trying to keep the infection local and prevent it from getting into your blood. When we have prolonged inflammation, then we get a little bit worried about that, especially when it's linked with chronic pain and illness. Okay, again, inflammation is non-specific. It's going to respond the same way to any kind of trauma, whether it's bacterial infection or heat or chemicals. It's going to prevent the spread of damaging agents. It's going to dispose of the cellular debris and the pathogens. It's going to alert the adaptive system and set the stage for repair. So there are 4 cardinal signs of inflammation. So that means 4 signs. So think about if you have a cut like this one on your skin, how do you know that it is infected and that inflammation has set in? The first thing I hope that you said was it's going to get kind of red. It might get kind of warm to the touch. Some grandma might call that like a local fever. You might feel around the wound and if the skin feels hot, it might swell like this toe right here, and it might cause some pain. Sometimes there is a fifth sign called impaired function, which basically means that you can't move or use that part of your body, and that is also protective. Okay, so step one, injured tissues release chemicals and say, help, help, we've been injured. Then mast cells and beta cells will respond and release their histamine and heparin. Remember, histamine, vasodilation, and increased capillary permeability. Heparin is going to be an anticoagulant. Coagulation is clotting or thickening of the blood. So we want to have lots of blood. We don't want it to clot. That's thanks to mast cells and basophils. Then we're going to have prostaglandins released by the macrophages and the tissues. That's going to also amplify the immune response. And then we have a new player called complement plasma proteins. So these are some of those big proteins that are in your blood that are non-nutritive, that stay in there, but they are going to be released in when pathogens invade, and they are part of opsonization. So I'll talk about opsonization in a little bit, but we talked about a little bit with phagocytes. So opsonization is where we help identify pathogens that have invaded, but the ones that are kind of wearing their costumes and hiding out among us. Complement proteins are kind of more like secret spies, and they can go and find out what's underneath the costume, tag it for a phagocyte. All right. All anti-inflammatory chemicals cause vasodilation. So we see the blood vessels are going to get bigger, increased capillary permeability. So that means the space between the cells. Remember, a capillary is just one cell thick, these little flat cells right here. So we're going to increase the space between them so more stuff can leak out. And all inflammatory chemicals cause chemotaxis. So at the site of injury, we're going to release a chemical that says, help us, and that will help the leukocytes, which are the white blood cells, and phagocytes find the damaged tissue. All right, step two, redness and heat. This is a direct response after step one. So if we have increased blood flow through vasodilation and increase, then we're going to see more blood. We call that hyperemia. And this is going to bring more cells to the site, but it does also cause two symptoms of inflammation, redness and heat. Okay, so the redness is from more blood flow, and the heat is from increased blood flow locally as well. And you can see here the tissue injury causes these different changes. So we're going to see the capillaries are going to get bigger. That increases blood flow and heat, increased permeability. The fluid is released into the tissues. That is going to attract the leukocytes so that they can chemotaxis, right? So they can arrive here at this tissue, and then they can diapedese and leave the blood cell. And then we'll see sometimes a systemic response. If we can't control infection locally, right? If you step on a rock and your big toe gets infected and we can't control that locally, then we're going to have a systemic response, which means fever, right? That goes everywhere in the body, not just at your big toe. And proliferation of leukocytes just means we're going to flood you with more white blood cells to fight the infection. All right, step three is swelling and edema. So when these capillaries and veins are leaking, that fluid is going to leak into the tissue, causing swelling that we call edema. Exudate is a big fancy word for the fluid that comes out of the blood that has really important stuff in it, clotting factors and antibodies. Edema is local swelling in the area. It does bring lots of important cells into the area. We also have some clotting factors that arrive, and they're going to be able to make a mesh and kind of like fence off the area, and try to keep all of the infection contained in one area. Keep it in the big toe, not going all through the body. All right, step 4 is pain. Pain results from swelling. That tissue is swollen and big, and that presses on nerves. It also results from the release of some toxins and prostaglandins. And remember, we have these NSAIDs that can reduce pain. Now, this chart, I pulled this off of the internet because it's really nice, and I like to show you that aspirin, as well as acetaminophen, Tylenol, ibuprofen is Motrin. Acetaminophen is not an NSAID, so I don't know why they put it on the chart, but I like it here because you can see all of these reduce pain. Ibuprofen is the best for pain. And then we have fever. And so you'll see that acetaminophen and ibuprofen are very good at reducing fever. Acetaminophen, this is Tylenol, doesn't do anything for inflammation. That's why it's not an NSAID. So that title is just wrong. But also aspirin reduces itchiness, which I always think is really interesting. Okay, so phagocyte mobilization, we call that leukocytosis. So here's big words. Let's not skip over them. We know a phagocyte is the Cookie Monster gobbling them up kind of bacteria. And leukocyte, this is white blood cell. Osis just usually means a lot of it. So what we're going to try to do is increase the number of white blood cells that we have circulating. So within 1 hour of the first inflammatory chemical release, this is from the damaged tissue, neutrophils respond. They are on the scene. They use chemotaxis to find the damaged tissues and cells, and then use diapedesis to get out of the blood into the tissue. We can release more neutrophils from the bone marrow. We'll see the levels increasing 4 to 5 times within a few hours. We're going to see the beginning of the complement cascade, which we'll talk about just in a little bit. And we're going to notify the adaptive branch. So basically saying, hey, we're working to try to attack this, but it's, we don't have any special control. We're just we need you to come back and give us some special guidance on this. Monocytes are going to arrive with the neutrophils in the blood, but it's going to take them about 12 hours before they can turn into a macrophage. And so really that's what I'm saying, that the neutrophils are there and they are just bombarding everything in their site. They die in the process. It takes about 12 hours for the macrophages to activate, and then they come and gobble up all the debris and work, including the dead neutrophils, and then work on killing some more stuff. This is a chart that shows you all these things that we talked about. So let's spend some time here. I'd also think that you should probably try to reproduce this. If we have tissue injury, we are going to have some of these inflammatory chemicals released: histamine, heparin, complement, prostaglandins. We talked about all these. These are going to cause 3 different events: vasodilation, right? Arterioles dilate, increase capillary permeability, so more stuff can leak out, and increase chemotaxis, which helps the neutrophils and monocytes and lymphocytes find the area that is damaged. Let's go over here. When arterioles dilate, we increase blood flow. That's called hyperemia. It's local, just to the area, not to the whole body. And that is going to result in 2 cardinal signs of inflammation: heat and redness. And then you'll see that heat, increased temperature, increases the metabolic rates of cells, so they just are working much faster. All right, then we see Over here, increased capillary permeability. So that means the capillaries leak more fluid. We heard that word exudate. That's going to be the fluid that contains the healing chemicals, as well as the clotting factors to help wall off the area of infection. That is, the fluid leaking is going to lead to pain, and it can lead to swelling, and swelling can lead to pain. And both of those together may temporarily cause you to lose function. So if your thumb is infected, it's probably going to hurt when you move it. And the idea is don't move it, because moving it can increase the flow of the bad stuff throughout your body. So sit still and don't use it very much, so that we can keep everything local and work on healing it faster. Okay. And then we talked about leukocytosis, particularly of the neutrophils. So we're going to increase the number of white blood cells through chemotaxis. The neutrophils are going to find the injured area. They'll cling to the capillary walls, but then they will pass through them through diapedesis, and then they will just go crazy phagocytizing all of the pathogens, dead tissue cells, and all of the mess. Neutrophils show up first and are short-term. Macrophages show up later and are long-term. Pus may form. Pus is mostly dead neutrophils. So when you pop the pimple and see that yucky white stuff, the pus in there, that's usually dead neutrophils. And all of that will lead to healing. All right, here we go. A little bit more pus, just in case you need to be grossed out a little bit more. If you don't know what it is this creamy yellow mixture of dead neutrophils and pathogens, dead cells, and debris. It's the garbage from the infection. This you can usually, will usually pop and drain itself. An abscess is where we have collagen fibers making a much thicker wall, and it's usually like more internal, and we'll usually have to surgically drain that, so put a drain into it. Some bacteria, like TB, tuberculosis, can resist digestion by remaining live inside the abscess, and they kind of just hide out there for years. Granulomas are tumor-like growths. They are areas in infected macrophages surrounded by uninfected macrophages and a capsule. And again, bacteria can live in there for a long time, but if your immune system drops, they can break free and now start causing disease.